Hi, you guys. Welcome back for our daily practice questions. It is day 235, and as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one-on-one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I have been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. But before we get started, don't forget to hit the subscribe button so you're not missing any of my videos. And if you would like to gain access to my NP Test Success Toolkit, it is free and linked in the description. The link to my website is also linked in the description, and it houses all the resources that I do offer. I also recommend if you're looking for a one-stop location of my business profile, simply go to Google and search The Nursing Studio. It will provide you my contact number that you can call or text, website with all of the resources that I offer, as well as testimonials from previous review students. All right, y'all. Question number one. A 22-year-old college student presents with a pruritic rash on her hands that worsen after frequent hand washing. On exam, there are erythematous patches with lichenification and small fissures between the fingers. No vesicles or honey-colored crust are noted. Which of the following is the most likely diagnosis? Is it A, allergic contact dermatitis? Is it B, atopic dermatitis? Is it C, scabies infestation? Or is it D, impetigo? Take a moment and tell me what you got in the comments, y'all. All right, y'all know I always recommend reading the stem of the question first as it allows you to slow down to ensure you're answering what is even being asked of you. So here the stem of the question states, which of the following is the most likely diagnosis? Well, I always tell you if the stem of the question is looking for a diagnosis, you got to run it back and look at the assessment findings. So we have a 22-year-old college student comes in complaining of a pruritic rash on her hands that worsens after frequent hand washing. Now, on exam, erythematous patches with lichenification, small fissures between the fingers are noted. There's no vesicles, no honey-colored crust noted on exam. So let's walk through what we have. One, classic presentation after hand wash, frequent hand washing. The lichenification is classic for B, atopic dermatitis, aka eczema, right? Now, as you work through these things, you can rule out a few. Where it says no honey colored crust noted, that helps you to eliminate D, impetigo. Allergic contact dermatitis is localized to the source of the allergen. This is happening when she has like frequent hand washing. Remember, like with atopic dermatitis, the drying of the skin, frequent drying can lead to this as well. Scabies infestation, although it does happen in the webs of the fingers, they're burrows noted. So pay attention to those key identifiers. All right, question number two. A 45-year-old woman presents with fatigue, weight gain, constipation, and dry skin. Labs reveal a TSH of 12 and a free T4 is low. What is the first line treatment? Is it A, levothyroxine? Is it B, liothyronine? Is it C, methimazole? Or is it D, radioactive iodine ablation? Take a moment and tell me what you got in the comments, y'all. All right. Stem of the question states, what is the first line treatment? So, I always say if the STEM is asking for a treatment, look to see if they provided you with a diagnosis. And if they have not, like in this case, you need to run it back and look at the assessment findings so that you can determine what it is. We got to know what it is to be able to treat it. So, based off of the assessment, this patient has fatigue, weight gain, constipation, dry skin. Presentation puts you in the mind of a differential hypothyroidism. The labs with a TSH of 12 being elevated and the T4 being low is also confirmation of hypothyroidism. So then you need to ask yourself, what is the first line treatment for hypothyroidism? And your best answer is A, levothyroxine, aka Synthroid, right? Now you can rule out C and D, methimazole and your radioactive iodine, as those are treatments for hyperthyroidism and not hypo. And your liothyronine is a replacement of T3, and it is not a first-line option for hypothyroidism. All right, lastly, question number 3. A 62-year-old man presents with left lower quadrant abdominal pain, low-grade fever, and mild leukocytosis. CT confirms uncomplicated diverticulitis. Which outpatient management is most appropriate? Is it A, a high-fiber diet immediately? Is it B, oral antibiotics plus clear liquid diet? Is it C, emergent surgical consult? Or is it D, a colonoscopy during the acute episode? Take a moment and tell me what you got. All right, and stem of the question here, which outpatient management is most appropriate? Asking about management is still a treatment question, so look to see if you have been provided with a diagnosis. And in this scenario, we have. The CT confirms a diagnosis of uncomplicated diverticulitis. So, what is the most appropriate management for that? And your best answer is B, oral antibiotics plus a clear liquid diet. As this is an acute case of the uncomplicated diverticulitis, you want to give antibiotics and clear liquids to allow the bowels to rest. That's the reason that we're not giving the high fiber diet immediately. We give the high fiber diet during the recovery phase, right? So after all of this has recovered, after they have recovered from this, you would do the high fiber diet, but not during the acute phase. This is uncomplicated. Emergent surgical consult is not warranted. And colonoscopies you do outside of the acute phase, when we're not in the inflammatory process of diverticulitis, right? So again, best answer is B, oral antibiotics plus clear liquid diet. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call. You can also shoot a text message to this number or shoot us an email to the email listed on the screen. And as I mentioned before, you can go directly to Google to our business profile by searching The Nursing Studio. And the website is linked in the bio of this channel as well as in the description of this video. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.